Okay, so I have a baby that was just born, so we're going to dry her off and get her to cry. Okay, lay her down to facilitate drainage and turn her head a little bit. Suction her out. Alright, we have her under the warmer. So at this point, we're going to do her 1 minute APGAR scale, which we'll also do at 5 minutes. So we're going to make sure that she's crying okay, meaning like that she's breathing good, that her respiratory rate is even and unlabored. We'll listen to her apical pulse for 1 minute. Okay. We're going to check her muscle tone, make sure that she's flexing. Okay, she looks good. And we're also going to check her reflexes, like that she'll pull away, that she'll have the Mora reflex. We'll check the sucking reflex, rooting, all of those. And put her hat on her for now. Okay, we'll get this wet one out from underneath her. Okie dokie. And so now we would get her vital signs to make sure that we use the right size cuff. We're going to check her brachial and her femoral pulses. Make sure that her color's good, especially in her trunk part. It's okay if her fingertips are around her mouth or her the tips of her toes are a little bit blue for now. We're going to check her fontanelles and make sure that they're flat, not sunken or raised. Okay, those are good. Check her Ortolani's, make sure that her hips are in good position and not displaced. They are good. We're going to check her cord. Pretend like that's on there. And make sure there's no excessive bleeding. Make sure there's 2 arteries and 1 vein. And hers looks really good. Put the clamp there for her. Then we will suction her. Go ahead and we will weigh her. So take her hat off. I'm going to hold her up and 0 the scale. Okay, put her back down, and I'm just going to put my hand over her so she doesn't fall out. Okay, she's about 7 pounds and 4 ounces. And now we can go ahead and measure her length. She is 27 centimeters. Very, very small baby. No, I'm sorry. And all the way up to the head. 30 centimeters. Still a very small baby, right under 12 inches. Measure the circumference of her head. And she's still under the warmer, so she's okay. Her head is 30.5 centimeters, right at 12 inches. Oh, we also want to measure the circumference of her chest. Which is okay if it's a little bit smaller than the circumference of her head right now. Hers is significantly smaller. Hers is only 20 centimeters. So now that we've checked her for everything, any abnormalities, we've checked her vital signs, everything like that. I'm going to go ahead and put a little diaper on her. Okay. We want to make sure that we put her bracelet on her and one that will identify her with her mother. We are going to give her a vitamin K shot, her vastus lateralis, And we are going to clean her eyes with just a wet washcloth. And give her erythromycin in her eyes so she doesn't get chlamydia or gonorrhea or anything from her mom if she had it. Okay. And like I said, we'll do the 5-minute APGAR, checking for her respirations or color, her muscle tone, her reflexes, something like that. Once we're all done, we're going to swaddle her so she doesn't get cold. She's beautiful. Okay. And then at this point, we would give her back to her mom to do some kangaroo care. And we will keep an eye on her. Oh, I would have also done a heel stick after I gave her a vitamin K shot to check for her blood sugar and make sure that it was okay. And I think that's about it.